In this video, we're going to talk about our ASA recommended NPO guidelines. So why do we tell patients to not eat or drink anything a certain amount of time before their surgery starts? It's not because we're mean people and we like to see people uncomfortable. It is because we want to minimize the risk of pulmonary aspiration. We want to minimize the amount of gastric acid and content that's in our stomachs from regurgitating and sinking down in our lungs and causing a whole list of badness. So we are going to, the way we're going to do ASA NPO guidelines is we're just going to draw this timeline here. And at time 0, we are time for surgery. And then each of these is 1 hour before surgery, each of these intervals. So we will categorize based on how far out we recommend patients eating certain foods. So the first one is solids and non-human milk. So solids and non-human milk, this can be categorized by a heavy meal. If they ate a fatty meal, which involves non-human milk. So we can say non-human milk. If they went to McDonald's, got a Big Mac, and if they downed it with some whole milk, then the recommended time to wait before their surgery is 8 or more hours, is 8 hours. If they had a small meal or a small snack that doesn't involve any milk or any cream, such as a tea and toast, so light meal, light meal, and that's non-fatty, that is going to be 6 hours before surgery. The recommended time that they should be NPO is 6 hours after they had their last light meal. Now, a lot of times patients will tell you, oh, I had a light meal, I just had something small. But it's really hard to discern whether or not they're, one, being truthful, and second, what type of ingredients were in that meal. So even if patients tell you they have a light meal, a lot of providers just try to be a little bit safer and try to mitigate the risk as much as possible of pulmonary aspiration. So they will defer and delay the case for 8 hours. But if the patient has tea and toast and no cream in their tea or no cream in their coffee, and they had a piece of toast or just some saltine crackers, then it is 6 hours. Now, the next NPO guideline is, let's say a patient wants to drink coffee and they don't want any cream in it because cream wouldn't put us at the 8 hours. Then the recommended time to wait until they have surgery is 2 hours for a clear liquid diet. So that's black coffee, that's water, that is Gatorade, things like that. The recommended time is 2 hours before surgery. I should say, some people could say alcohol is a clear liquid, no alcohol is allowed. What about patients who are breastfeeding? So the recommended NPO time for patients who are breastfeeding or ingesting breast milk is 4 hours. So breast milk may be ingested up to 4 hours before surgery. And now, what about pediatric patients who do not consume breast milk, but they consume infant formula? That would be, you would consider that the same as you would consider it a light meal. So infant formula. So infant formula may be ingested up to 6 hours before surgery. And that is essentially the NPO guidelines. So a fatty meal with milk or cream in it may be ingested up to 8 hours before surgery. Anything past that is not recommended. Infant formula or a light tea and toast meal, non-fatty meal, should be ingested up to 6 hours before surgery. Breast milk should be ingested up to 4 hours before the surgery, and clear liquids should be ingested up to 2 hours before surgery.